meeting. Um, okay, so welcome everyone. Thank you for joining us. For those of you that might not know me, my name is Matt Scalabrino. I'm your undergraduate medical education account manager. And I would like to introduce our presenter today, Dr. Delia Chiaramonte. She is our Director of Medical Education at McGraw-Hill. She's a board certified in family medicine and palliative medicine and holds adjunct faculty appointments at the University of Maryland and Johns Hopkins School of Medicine. Dr. Chiaramonte is an experienced medical educator. She served as a director of education in medical school clinical division, worked as faculty in family medicine residency, has held national positions in medical education, and served as division chief of palliative care at a community hospital. Her teaching experience includes curriculum design, large group didactics, small group experience, bedside teaching, creation of a month-long medical student elective, and design of online graduate level courses. She has won awards for teaching excellence and has been voted a top doctor by her physician peers. So I will hand it over to Delia now to give our presentation, and feel free to ask questions or enter them in the chat if you'd like.
Thank you so much. And thanks everybody for taking time out of your busy day to be here with us. I really appreciate it. So we're going to talk about active learning in medical education today. So just to reframe or frame our the way we want to think about learning, when we're thinking about adult learners, what are the things, just to remind us that they want? They want to be engaged, and I think even more so than before, learners want to be engaged now. They want it to mean something. Adult learners can't stand learning something that they can't think of a reason for. They want to be active and they want to have the learning aligned with whatever their goals are. And medical students, often their goals are to do well on exams, of course. We also want to engage them in the goal of becoming spectacular doctors with great critical thinking skills. They need, like all of us do, repetitive learning in order to cement particular topics and facts. They really like autonomy and they like feedback. So, what are some of the challenges? Of course, we know that in medical school, there's a humongous cognitive load. And now more than before, there are just overwhelming resource choices. And sometimes when you have too many choices, it's almost like you have no good choices because you don't know what to do. And so medical students will find themselves trying this, trying that, trying that. They heard from one senior they should try this resource, and someone else said they should try the other resource. All of that wastes time and increases their anxiety. And what we want to steer them away from is learning that is just focused on exam learning in their mind. And most importantly, we want to steer them away from learning that is just passive. So put in the chat, if you wouldn't mind, what would you say in your experience is the number one thing that gets in the way of your students getting to where they want, succeeding how they want, succeeding how you want them to do? If you wouldn't mind, I would love for you to put, what would you say is the number one thing that gets in the way, that is a blocker, that is a problem for your students? Time management. Yeah, exactly. And part of time management and distractions, I'm going to put those together, is if you have all kinds of resources and you're jumping from one thing to another, all of that is wasting time. Another is listening to senior students about their experience, because learners are different and what worked for senior A may not work for you, and senior B might give you completely different advice. And again, someone shared, right, exactly, a lot of information. So when there's so much information, we almost can't take in any information. And so we want to frame it in a way that they know just where to go for what kind of information and they know what to do with it. So that's why we're talking about active learning today. Thank you guys for sharing that. Now, I know you all know about Bloom's taxonomy, but I just want to remind us because, of course, when we get higher up in the pyramid, we help people cement their learning better and we get away from just memorizing things to really integrating things. So just as a reminder, the bottom level, which we need, but is absolutely not sufficient, is remembering. And some students get a little stuck there. Like if I just remembered all the facts, I would be fine. But of course, that's not right. The next level is understanding. Things like not list the symptoms of, but what's the pathophysiology of. The next level of is how do you apply that? So that's of course what happens when we go from the classroom into the clinical experiences. You could learn a lot of things and even understand disease, but then you see a human in front of you. How do you apply what you learned? Analyzing is the next level. So how do we compare this thing to that thing? How do we compare viral to bacterial? How do we compare this presentation in an older person versus a younger person? A key skill that I think students don't always know that they need. You know they need it, but they may not know that they need it. Evaluating it, meaning you're looking at the information and making judgments about the information and then creating something from scratch is the top level. So when we are teaching students, we want to give them exposure to all of these things. And I actually think it's helpful to share this concept with students because they can be overwhelmed and think, there's so many facts, I don't know what to do. If I just memorize all the facts, I can do well on boards. And that is, as you know, such a simplistic way to look at it, and it also doesn't work. So if they can see these are all of the parts of learning that they need, these are the cognitive skills that they need so that they can start to think, okay, in this task that I'm doing right now, where am I in this pyramid? I think it's helpful to give students a framework for this. And also, it makes them rebel less against working cases, for example, because they may think, well, I just need to study. I just need to be home by myself and study. But in fact, no, they need to learn to apply and analyze and evaluate, those are active learning tasks. So just a simple example, if we were thinking about hypertension and we want to teach students about hypertension, the very bottom of the pyramid is just list the things. What are the stages of hypertension? Yes, you have to know that to start. But then let's really understand it. Why does this antihypertensive work and this one works differently? So what are the mechanisms of these different antihypertensives and who should take which one? So applying it, which medicines or group of medicines should I use for which patients based on their risk calculation? Analyzing it. How do we differentiate between primary and secondary hypertension and what diagnostic findings are we looking at? What's the pathophysiology of this kind of hypertension versus that kind of hypertension? Evaluating how do we critically appraise the literature? And then creating how do we develop a patient-centered treatment plan for a really complicated patient with multiple comorbidities that looks at lifestyle plus meds plus counseling plus follow-up. Okay. The reason that we're talking about active learning is this, because look at the percent of learning retention after 24 hours for the various kinds of ways we can deliver information. Lectures, sadly, as one who also does give lectures, including this one, it's very sad to know that only 5% retention after 24 hours. Reading is a little better, audiovisual aids a little better. Presentations and demos, because they're more engaging, are better, but look what really works. Discussion groups, practicing, and then teaching others is the best. So that I think, we'll talk about it in a minute, but that's an underused resource is having students teach each other. Because look at the difference in retention between lecturing about something, even if it's the most spectacular lecture, and making an environment where a student can teach another student about information. Look how much more they retain. Okay, so the biggest importance around active learning, yes, it's more engaging, yes, it increases retention, but it avoids what I think is an important concept, which is the illusion of mastery. So students read things, they highlight them, and they think, I got it. Because when someone says, oh, remember, this is how lupus presents, they go, oh, yeah, I know that. But if you closed all the books and closed the computer and you ask them to generate it, they might not be able to do that. But they might not know that they might not be able to do that because when they look at it, they recognize it and they think that means they could recall it. But the only way you know if somebody can recall it is you ask them to recall it. And of course, we do that in exams, but it's so much better to do that way before exams, to do that as part of the learning process. Okay, so I'm just going to give you some examples of how you can integrate active learning into the medical school environment. This is absolutely not the only way you can do it. I'm not saying what I'm bringing up are the best ways. I'm just giving you examples various ways that you can do it. And I will include how you can use some of our McGraw-Hill resources in this process. But first, let's just talk for a second about case-based learning. So there are different kinds of, I'm putting case-based in quotes, as in PBL is also, quote, case-based. TBL, so problem-based learning, team-based learning, case-based learning, all are ways that you can put students in small groups, engage them in working a case, and have them actively involved in their learning in that way. All of them are great. PBL, we could do a whole lecture on PBL. PBL is more self-directed. Some schools have whole curricula around PBL, but you don't have to do that. You could practice PBL in a small way. But honestly, I think the easiest way, if you're not already organized in a PBL curriculum, the easiest way to do this is just to use case-based learning and stick it in where it makes sense in your curriculum. And we'll talk a little bit more about that. Case-based learning is still faculty driven. The faculty knows what they want the students to learn, and they're putting it in the context of a case. Problem-based learning is much more student driven. It's great, but you don't have to do that. So I don't want you to feel like, well, we're not going to do the whole PBL thing, so we're just going to do lectures. There's so many great places that you can integrate case-based learning into the medical education experience. So these are just some examples. Flipped classroom is a great one where the students review the information before. So rather than coming to lecture to learn about rheumatoid arthritis, they learn about rheumatoid arthritis last night at home using videos or readings or whatever resources you assign to them. And then when they come into class, that's an active learning experience. So they can work cases with you. There can be a discussion. There can be, you ask them questions, they answer it in front of the group. They can teach each other. They can do question-based exercises. But the concept is you're not actually teaching the material. They learned it last night. You're working with the material with the student. It's a really easy switch to make if you're not already doing it. And it's a very powerful learning experience for the students. So you can do small group discussion. So you don't have to do flipped classroom with a small group discussion, but you could. So you could have them learn last night and just have small group discussion today. Or you can have half the hour with lecture and then have them do a small group discussion after the lecture, for example. You could do sim labs, of course, role plays. So it could be official sim labs that you have at your school, but it doesn't have to be that. You can do role plays around counseling skills. You can use clinical reasoning products. McGraw-Hill has one, but there are others as well. So just the concept that they practice something and then get some feedback, which you can do in the lab, but you also can do some in the classroom. Peer teaching, like we talked about, is really powerful. Remember, that was the one where people remembered the most. 90% of what they teach, they retain. So if you can have students teach each other, maybe student A teaches about one topic and student B teaches about another topic, and then they discuss, that's a way to increase the active learning and increase their retention. You can do audience response polling. So you can just do it by raising your hand, or you can do it with tools where you ask a question and say, who believes that the next step is this? Who believes that the next step is that? And then you look at what the class said and discuss why one is not correct and why one is correct. You can use question-based learning where you do practice questions. I think lots of people do that, but you also can do those questions out loud. So it's one thing to say to students, go do your questions, but it's another to work the questions as a group. And you even can do that in a large lecture hall. Think, Pair, Share is a great tool that you can use whenever you feel like it. So you could just use it in, one class a quarter. It doesn't have to be that you go from lecture-based learning to 100% active learning. You can just put this in wherever you want. And the concept is students, you ask a question. So here's a case, what would be the best next step? And the students first think, what do they think is the answer? And you have them write it down. They should commit, so they should write it down. Then once everyone has had the time to write down their answer, then they discuss it with a partner. So it could be just with the person sitting next to them. You could have put them in small groups, but you don't have to. So they could just discuss with the person sitting next to them, this is what I think the answer is. The other person says, this is what I think the answer is and why. And Even better, if they disagree, they can talk about why one thinks one thing and one thinks another. Then they either share with a large group, unless you have hundreds of people. If you do, then you share with the group. So first they say what they think, then they talk about it with another person. Then either you get everyone to share their view and then you tell the right answer, or if it's too big a group, just you tell the right answer, you share the right answer with the whole group and discuss why. So you might seek from people who chose a different answer. No no one will get in trouble. So if they're willing and they feel safe, who chose a different answer and why? Let's talk about why that answer, why you thought it was that, but why that wasn't the right answer. Because then you're teaching not just that student, but you're teaching everybody else in the room who chose that wrong answer. And when we make a mistake, then we learn why we were wrong. That one sticks so much better than if we just guessed the right answer or if we just took a test on our own. So think, pair, share. Great thing you can just throw in whenever you feel like it. Concept mapping is a really powerful tool. It's more complicated, but not that complicated, and it's really powerful. So the idea of a concept map is that students make a visual representation of the relationships between the various concepts. So the relationships between presentations and what they could be, between medications and side effects, between a symptom presentation and the differential diagnosis. So there's lots of different parts to a concept map, and I'm going to show you an example in a second. But the concept here, the concept of the concept map is that it stops students from just trying to memorize things because they have to understand all the pieces. And also for some students, it's a memory tool. They might even remember, oh, the answer, the differential diagnosis was over here on my concept map. And the act of creating a concept map is what's really powerful. So you don't just give them a concept map. That's okay, but it's not as good. Better is you give them a topic and guidance, and they create the concept map, either themselves or in small groups. And then, of course, you review and make sure that they're correct. But then they have had to research things in order to make it. They have the visual representation themselves, and then they pressure test it with you or someone else who's checking their accuracy. So an example of an instruction around a concept map might be map the pathophysiology of diabetes, linking insulin resistance and the metabolism of glucose and complications like neurologic complications, renal complications, and cardiovascular complications. So you've given them a guide, but now they're going to see what is diabetes, what's up with insulin and glucose metabolism and insulin resistance, and then what does that do to the kidneys? What does that do to the neurons? What does that do to the cardiovascular system? So here's an example. Oh, nope, not yet. Soon you will see an example. So how do you do it? You choose a topic for them. You can suggest the branches if you feel like you need to, although once they get in the habit, so if you have students who've been practicing concept maps, you may not even need to give them the branches, but then you want them to make connections. Ideally, you would not give them the connections. They need to make the connections. And then as they learn more, they go back to their concept map and update it. So it becomes kind of a understanding of the concept tool for the patient, for the student. And then they may have a whole part that's empty. So maybe we didn't do treatment yet. And you can say that part of your concept map is empty, but next week we're going to do treatment and then we're going to go back and iterate and add that to the concept map. So here's an example of a concept map for right heart failure. And so you can see that there's a part that talks about the heart. There's a part that talks about the lungs. There's a part that talks about pulmonary vasculature. There's a part that talks about hepatosplenomegaly. So what happens down the road? What happens if the right ventricle fails? So there's not like a one and only way to make a concept map, but you get the idea of the concept of the student picking all the pieces and how they work together. And ideally, they don't come in knowing all this. They come in with the guide and they have to go research. They have to go look up, well, what happens to the pulmonary vasculature? I need to look it up in order to put it on my concept map. Okay. So we're going to talk a little bit about tools, actual tools, including Boards and Beyond and First Aid Forward. and how we can use these tools to do the things that we've just talked about. So just a couple slides on what are these things, what are Boards and Beyond, and what is First Aid Forward. So Boards and Beyond uses videos to educate, and there is evidence that learning from videos increases understanding and increases knowledge retention compared to just reading. Plus, students like them, and they can use them on the go. We have had our students say that they really like using them sort of like a podcast because maybe they're working out or they're commuting and they still can listen. They couldn't be reading then, but they can still listen and get repetition that way. Okay, so just a tiny primer on what is Boards and Beyond. So Boards and Beyond has a step 1 product and a step 2, also maybe 3 product, but for you guys, step 2 product, preclinical and clinical, one that's more foundational and one that is more clinically focused around the students who are in rotation. In Boards and Beyond Step 1, there are 500 videos, more than 3,500 USMLE board style questions, high quality questions. Boards and Beyond Step 2, 260 video lessons, more than 1,300 board style questions. And then we do have a couple other collections, including one called Clinical Confidence, which is focused towards students that are just about to go to their rotations and or just about to go to residency. And we have 4 of those, one for internal medicine, one for pediatrics, one for OBGYN, and one for surgery. Those are much more practical. Students really appreciate them, and they have topics like what are all the different kinds of blood products that you can order, or what are the different kinds of tools, instruments that you'll find in the operating room, or how exactly do you do a consult on surgery rotation, things like that, things that are not so much going to be just in the book of learn about cardiovascular disease, for example. And then we have an OMM series that is focused on osteopathic manipulative medicine skills that is very helpful for people in osteopathic schools. Okay, so just to give you a vibe of what these products are, this is a Boards and Beyond video, so a screenshot of a video. And you can see that not only is there the video, which is running, would be running, but as it's running, there's a transcript that you can see on the side. And the transcript is spectacular because you can search the transcript. So if you got to a video and you wanted to know about a certain topic or a certain medication or a certain term, you can search it and it will not only take you there in the transcript, it will take you there in the video. So it makes it much easier for students to find exactly what they want, or faculty who are considering assigning these videos to find, does this video cover this thing that I want, and where is that in the video? So how can you use Boards and Beyond? You can use it to supplement your curriculum. So there are people who map the videos to the curriculum and the learning objectives. So particularly if we're saying, we really want to use you faculty as mentors and guides to learning and not just deliverers of information, the Boards and Beyond videos can deliver the information, for example, in a flipped classroom, so that you can work with the students in active learning tasks in the classroom. So you could look at your whole curriculum, map which videos relate to which topics, assign the videos so students know to watch them last night so that today in class, we're going to work a case. You can use it as a remediation tool. So if you have a certain student who is struggling either globally or in a particular topic, you can have targeted playlists for those students to say, you know, you're not doing so well in neurology, so I want you to watch this playlist of neurology videos. As I mentioned, people use them as a podcast when they're out and about or commuting or exercising. And in people who are doing clinical rotations or having clinical experiences, you can assign the topics related to what they saw that day. So you could ask them to write down what are 3 patients that you saw that day and confirm that you watched the videos that are related to the problems that those 3 patients had. Excuse me. Okay, First Aid Forward has the first aid book digitally, easily searchable. It has also, though, clinical cases and patterns. So this is a resource that you probably know students love. It has tons of really specific things for them to know and memorize. But of course, it's not all of medicine. It's not sufficient. And so that's why the combination of First Aid Forward with Boards and Beyond is so powerful. Because if someone is looking at a page in first aid and they say, okay, I need to memorize these three enzymes, but I don't really understand the process, they can go to Boards and Beyond to figure out and learn and understand the process and come back to first aid forward to the first aid book for reinforcement. So it also, though, has cases, which we'll talk about in a minute. It has a book of clinical pattern recognitions so that students can start to think about when I see elevated LFTs, when I see a patient who's short of breath, what are the differentials that I should be thinking of? How should I proceed? Which of course takes them out of the let me just memorize about hepatitis, but more, what do I do? What should I be thinking about when I see this in the clinic? And then it has subject level quizzes, more than 1,000 questions, and something called AI Reader, which is AI generates just knowledge check questions, not USMLE style questions, just quickie. If you want to say, I just read this text, quiz me on a couple questions, you can do that right within the product.
Yeah, I think we have a question. Lynn, you have your hand
Sure.
raised.
I, it's not so much a question. The faculty from Morehouse School of Medicine that are on here, they know we don't have first aid forward and Boards and Beyond at the moment, but between Matt and myself and a few other people, we're actually signing the contract for that today. So those links should be live next
Awesome.
week. So those of you who and that's in part because so many faculty and students asked for it. So those of you who are thinking, okay, she's showing us this, what's the point? I want it and we don't have it. Yes, we will have it in the next 72 to 96 hours. So just hold tight, and as soon as that's live, and Matt is on here, so I'm sure he knows that's why I wanted to come on the mic and let you all know that it will be
Yes.
available to you. So it'll be available to you in the next couple days.
Yep.
Thanks for allowing me to interrupt.
Thank you
Thank you
so
for
much.
mentioning that, Lynn. Thank
Yeah,
you.
no problem. Yeah, I needed them to know that.
That is very timely information. Thank you so much. I appreciate that. Yeah, so wake up and listen, right? Because you will actually have access to this. That's terrific. Thanks. Okay, so here is something that is very powerful, which is that Boards and Beyond and First Aid Forward are linked. In the product, they are linked. And so what this arrow is showing you is on the top, you're inside the thyroid cancer video. And this thyroid cancer blue link next to that red arrow, if you click on that, that will take you to the first aid page on thyroid cancer, as an example. And so all of the videos are linked in this way. And what this does is if a student is watching the video and they think, all right, I think I got it, but what are the really key things that I need to make sure I know? They can click on this link. It takes them to first aid, which is like a cheat sheet, right? Like way back when I used to make cheat sheets myself. So then they can say, okay, here's the things I need to memorize. I need to really understand, make sure I know this. And on the flip side, it goes the other way too. If they are in first aid and they're looking at it and thinking, all right, I see this, I guess I could try to memorize it, but I don't totally understand what they're talking about, they can click into the video, which will give them somewhere around 20 minutes of really high quality education about the topic. So they can say, okay, now I understand. Let me click back into the first aid page, make sure, do I understand all the pieces? Yes, now that I watch the video, I understand all these pieces. So that ability to quickly go back and forth is tremendously powerful. There are metrics. I'm not going to talk about that today, but just so you know, there's metrics so you can see if you assign something, did the students watch it? If you assigned quiz questions, did they do them? And how well did they do both the first time they attempted and the best time they attempted? And the reason we do that is that the first time around, you get a sense of how much do they actually know, but also you want to know, did they ultimately understand the information later? So you can see, did they do it, how they did the first time, how they did the best. And then in a similar way that we talked about before, this sort of tension between memorizing and understanding. A lot of students use Anki cards, as you may know. So those are not ours. That Anki is its own thing. People have feelings about whether or not students should be using flashcards, but they do. We just accept that they do. So one of the things that we recently made possible is that when a student is in an Anki card, they can click from there into the Boards and Beyond video. So it's really the same concept as we talked about before. If they're in a card and they just feel like they're memorizing, but they don't really get it, they can click into the video to make sure that they understand. Okay, so how do we put all this together? Like we have all these things, and we talked in the beginning that having too many resources is almost a problem, right? There's so many companies, there's so many people on Reddit that say you should do this, you should do that, you should do this other thing. How is a student supposed to put it together and make a plan so that they're not wasting time checking out resource A, B, C, D, E, and F? We don't want them to do that. So putting it together in a way that makes sense is important and is helpful for the student and for the faculty. So for new concept introduction, like we're learning about a new thing, I want you to know this and I want you to understand how does Ehlers-Danlos syndrome work? What is that and how does it work? So we're starting from scratch. I need you to understand it. Boards and Beyond videos are terrific for that. They're somewhere around 20, 25 minutes long for the most part, some shorter, some longer, but nothing more than 30 minutes. Those are really about new topic, understand all the key things in this topic. Then though, student watches the whole video and remember there was this concern about just that because you recognize it doesn't mean you can recall it. We do need to reinforce, and there are things that they need to memorize. So for content review, pulling out what's really important for exams and memorizing what you need to memorize, first aid is perfect for that. It reinforces and helps people memorize. And then for applied use, for practicing clinical reasoning, first aid cases and patterns and quizzes allow people to practice active learning and self-assessment. And ideally, in my personal editorial opinion, ideally, they're practicing some of that active learning in the classroom with you, as we talked about before, but they also, of course, can do some at home. But that's how I would put together this landscape. Learning with Boards and Beyond videos, reinforcing with first aid, and active learning and practice with the first aid cases, patterns, and the quizzes. So that's a big picture concept. Here's just an example, and these are just examples. I have a couple different examples. Don't feel like I'm saying this is how you should do it. I'm really just trying to give you a vibe that, oh, this, we could do a thing. We could do it this way. We could put the blocks together in this way. So here's an example of a sample teaching module for heart failure. Before class, you could assign people to watch the videos on heart failure basics and Starling curve and systolic and diastolic heart failure, acute and chronic heart failure. So watch all those first before you come to class. In class, we can do a case on heart failure together, and we can look at patterns of dyspnea that is from a cardiac etiology. Then after class, go do the quizzes on Boards and Beyond, which are USMLE style quizzes. And now most videos in step one have about 10 questions, but between 5 and 10 questions. We're working up to all of them having 10 questions each. So assign the quizzes that are associated with those videos. And then in First Aid Forward, look at first aid, read over the heart failure. And then if you want to look for analytics, you can see whether they did that or not. So this is just an idea of like, here's what you do before class, here's what we're doing in class, here's what I assigned to you to do after class for heart failure as an example. So the concept is faculty going from content deliverer, because now there's a lot of ways to get content. Once upon a time, it had to be from faculty, but now in this new world, there's a lot of ways to get content. So you can actually do what's more important, which is helping students do something with the content that they learned before they came to class, coaching them on what they didn't really understand, fixing the errors, helping them integrate this information and use it, practice what you just learned into actually pretending you're a doctor and working a case. So it's really a frame shift, a role shift for faculty from I deliver content to I am your mentor in learning how to be a doctor, which is different. And of course, faculty is always helping people become doctors, but it is a shift. I think it's a good shift. It's a fun shift. It's actually more fun to work with students and help them process a case and see where their thinking is going wrong and redirect them. That's more fun than just lecturing to a bunch of sleepy people for an hour. So I think it's a great change, but it does cause some discomfort for some people. But I think we should just think of faculty in a more practical and important and hands-on sort of way. Because information is everywhere. Information is everywhere, but nuance they're going to miss. And integration, interpretation, they're going to miss. You know that, and you can help them see that. So I'm just going to give you a couple examples of different ways you can think about it. So something they can do before class, you can assign the Boards and Beyond videos. You can say, quick review of First Aid Forward, just look at it. During class, we're going to work through cases or patterns or algorithms, or you're going to create a concept map as a group. Then after class, go back and look at First Aid again, do the quiz questions, and then if there's something you're confused about, go back and watch the Boards and Beyond video. So I'm saying in a way the same thing in slightly different ways because I want you to see it's not complicated. You don't have to change everything you're doing. It's just a little bit of a frame shift about how you can use these other resources to help make your teaching more effective and also more fun. So here's just some specifics. I'll zip through this so you can see what this looks like. Boards and Beyond. So before class, here's a Boards and Beyond video. Here are the ones that you could send them to. Let's say we sent them to Heart Failure Basics. So they're going to watch Heart Failure Basics plus the others that you assign. They're going to read before class. So they're going to click from Heart Failure Basics right into First Aid because they have that connection we talked about before. So they can watch the video. They can read over the First Aid page. If they want to do a couple knowledge checks, they can ask the AI to give them a couple questions about the text that they just read. In class, you're going to look at first aid cases and clinical patterns. So the first aid case could be a heart failure case. The clinical pattern could be heart failure with reduced ejection fraction caused by ischemia. These are within your first aid forward, so you have access to all of this. This can be kind of your guide of what you're going to do in class actively with the students. Post-class, these are the Boards and Beyond quizzes. They're going to go do the questions on all of the videos that you assigned. Here's the one on heart failure. Post-class, if you want, you can also have them do the quick hit questions from First Aid. These are not USMLE style, but they're just sort of quicker, easier questions. If you want to assign those, you can do that. Here's just another quick learning example. So before class in a flipped classroom, again, you can assign Boards and Beyond videos. You could assign them to do the questions before class if you want. During class, you could do a think, pair, share on one topic that you think is particularly important. You could have small group discussion on that same topic or a different topic. And you could have them make a concept map in class if you want. They can use the resources. Oh, we have to go watch that video. We have to go look at the first aid page. We have to go look at the algorithms to make our concept map. You could then have them present the concept map either in their small groups to each other or to the bigger group. You could have students write vignettes. So if you're doing a cardiovascular topic, MI, say, or chest pain, you could have them write a vignette for a very young person who's on birth control, a vignette for an older woman, for someone who's doing cocaine, for someone who passed out at school during gym class. So you're having them write the vignettes for the various kinds of presentation. Obviously, you're teaching them that MI can present in different ways. But rather than just saying, here's how MI presents in this population and that population, you're having them create a vignette and then teach it to a peer, which, as we know, increases the amount of information that they retain. And then after class, you could assign some first aid questions. So just an example, again, of how you could do it. Here's another example. You could do 40 minutes of regular focused teaching like you're used to, but instead of doing 60 minutes, you could do 20 minutes of first aid forward question debriefs. So you could stop the lecture, say out to the class, okay, here's the question. And you could ask for, hey, who thinks this is the right answer? Who thinks this is the right answer? Who thinks this is the right answer? And then you could explain the right answer. Or you could pull up the question and then have them do a think, pair, share. So here's the question, write down what you think the answer is, talk with your peer. Now, a couple people tell me what they thought the answer was. Now I'm going to tell the whole class what the right answer was. So in this example, you don't have to throw out your lectures. You just cut them down a little bit and you save some time to do more active learning. So I want you to think, you can do little things. You can assign questions before the teaching because when we have done questions and don't know the answer or have gotten it wrong, we receive information differently. As I said, they can watch videos before class and work a case in class. You can use poll technology in class. You can add one case-based learning per week to a topic or per quarter if per week seems like too much. Just like get your toes wet, just practice it. You can lecture for 30 minutes and do things as a group, a case for 30 minutes. So it doesn't have to be, I threw out all my lectures. You can do a little bit and a little bit. You could even just take 5 minutes to do a think, pair, share with hands raised or via poll technology if you have that in your large lecture hall at the end of every lecture, 5 minutes. They raise their hand, what they think the answer is, you tell the answer, 5 minutes. But even that, asking them not just to listen, but to pull out, this is what I think the answer is, and I'm going to write it down, just that is a change in how they learn. So even if you kept all your lectures, you just took 5 minutes at the end to do that, you're starting to practice active learning. So we're almost done. And if you were to add active learning to one class or a block or a topic, you're not being held to this, but what do you think you would start with? If you would write in the chat, if you were to add active learning like next week, because you're going to have access to these resources, what would you do? And Matt, for some reason, oh, no, I got it now. Let's see. So think, pair, share in a flipped classroom. Terrific. Any thoughts about a topic? Do you want to do it on a particular topic, or do you want to do it on a particular kind of block or a particular day of the week? What would you do if just next week you were going to start to do a thing? What would you do? Discussion group and a case study. Great. So we have think, pair, share, flipped classroom, discussion group, and a case study. Terrific. And so you probably can see that what I'm asking you to do is take the information that I gave, which you are receiving passively, and put it into the active part of your brain. So once you've written down, I think I would try think, pair, share. You're more likely to actually do think, pair, share than if you just heard me say it and then you went off to lunch and then you forgot about this hour that we spent together. So I would encourage you, even if you don't want to write in the chat today, that you write down, put it in your notes, write down what you think in the next month you will try. Because I want to acknowledge that going from the way you've taught before, if you're not already doing these sorts of things, to starting them, it feels a little anxious. I don't know how will it go, I don't have as much control. Just do it. And it doesn't have to be perfect. Just try. And once you try a little thing and you see that it's kind of fun and it's interesting and engages the students and nothing terrible happens, it becomes easier and easier to do it. Yay. Thank you. Sharon said that you've already jotted down some ideas of what you could do. Spectacular. Flipped classroom for hyponatremia. I love that. And I love that because it's so specific. So if you just think in your head, I could try a flipped classroom one day, you might do it. But if you write down, I'm going to try flipped classroom for hyponatremia, you are much more likely to do it because it's so specific. So you can see just for yourselves, just what we just did, that's what you want to do more of with your students. And I really encourage you, write down for yourself one thing that you'll try over the next couple of weeks, and then just try it. And if it's not perfect, it doesn't matter. Just try it. Thank you guys for participating. I really appreciate that. Okay, so sometimes people get sort of freaked out about external resources like, oh, students won't come to lecture, they won't think I'm important, we're just teaching to the test. But I would encourage you to think of this in a completely different way, which is if you're using these resources to help students practice active learning with you in the classroom, it's the opposite. They have to come to class. They have to come to class to work the really important learning parts. And you become so much more important. If we as faculty just lecture all the time, students realize they can get information everywhere, but they can't have somebody working with them, finding their mistakes, helping them change when they're thinking incorrectly. That requires you, makes faculty much more important. So just a reminder, Bloom's taxonomy and what are the cognitive skills. So if we start at the bottom, remembering, what are the things that help with remembering? First aid and the flashcard integration with Anki. What helps understanding? Boards and Beyond and first aid. What helps application? First aid cases, clinical patterns, and clinical reasoning. What helps with analyzing? First aid cases, clinical patterns, clinical algorithms, and we have a new product called clinical reasoning. with evaluating yourself, first aid quizzes, the Boards and Beyond USMLE style quizzes, and PI, which is a new clinical reasoning product. And then creating, how do they create? You can have them create a concept map, but they're going to need some resources because they don't already know everything. So they can use the resources of Boards and Beyond and First Aid, Access Medicine, et cetera, to create their concept map. And again, we talked about adult learners. So how do these tools fit in? Engaging, Boards and Beyond videos are engaging, first aid forward, people like clinical reasoning, and this interactive tools are very engaging, students like them. Connecting to real world applications, cases and patterns, and clinical reasoning, those are real world cases. Active learning, cases, patterns in class with you, and clinical reasoning. They want to pass boards, so what aligns with their goals? The USMLE style questions, first aid, and PI. Repeated exposure to concepts so that they can memorize and retain. Videos so they can go back and watch if they want to. First aid forward, the cases, algorithms, and patterns. And autonomy and feedback, stuff that they do at home, and then quizzes that they do either at home or in the classroom. But most importantly is the feedback they will get from the active learning experiences from you in the classroom. And that's it. Thank you so much. I would be happy to take questions. And also Dr. Ryan, Jason Ryan, who made Boards and Beyond, is here, and I'm sure he would also be happy to take questions. Thanks so much.
There was
I
one
have a
question
question.
in the chat.
Okay.
If you
I have trouble. Sometimes I can get to the chat and sometimes not. You want to read it out loud?
yes, from Sharon Francis. What if there are questions that arise after doing the assigned post questions after class? Is there a discussion in the quiz that tells students why the answer selected is correct or incorrect because we are only assigned to meet with students in person at a specific time?
Yeah, that's a great question. Yeah, so the Boards and Beyond questions and the first aid questions both have an explanation of the correct answer and have explanations of the incorrect answer. So why the incorrect answers are incorrect, and then usually a little learning nugget about them. Jason, I don't know if you wanted to add something to that.
No, I agree with everything you said. Yeah, I have nothing to add, but happy to answer more questions.
Thanks.
Okay, if there are no further questions, then I think we can wrap this up. I'm going to put my email address in the chat, and any of you can feel free to reach out to me directly with any questions or if you need help with anything. As Lynn mentioned, these resources will be available to you and your students within the next few days. So we're very excited to get that started for you, and we'll have more information to pass along on how to get set up and everything with that. But feel free to take my information down and contact me for anything that you need. Thank you all very much for joining us today, and we hope to see you again, be in touch with you regularly. So thank you very much.
See a hand.
I do
Oh,
have a question. I put it in the chat. Is it possible to use the questions in Boards and Beyond, insert them in teaching slides?
That's a great question. I think so. Jason, do you know the answer to that question?
Um, if you're, I mean, I'd have to check with our contract people. This is not my area, but if you are an institutional subscriber to Boards and Beyond, I don't see why you can't screenshot a question and put it into a slide. I don't think anyone would have a problem with that if you're using it within a paid subscription. You know, they're proprietary questions, of course, but we provide them to you as part of your institutional subscription. And, you know, we don't have a way you can just click on the side, the site and get it on a PowerPoint slide, but taking a screenshot, I think
Oh,
would
okay.
work.
Okay, I was just wondering if if you could just click on a link and it will take you to the question. Okay.
I mean, you
Oh,
could
yeah.
open the quiz on a screen in class and show the question, or you could take a screenshot from your office computer and put it in a PowerPoint slide. And I don't think anyone will have a problem with that if you're an institutional subscriber to the service.
Okay, thank you.
Yeah, and that is a great way to use it. So as Jason said, if you have access, if you can just link right to it, you can go through the questions as you want to with the class. Or if you're taking a screenshot and putting them in advance in your slides, the concept though that you would bring up the question and don't give the answer right away. right? That you seek the answer from the students,
Right.
either everybody raise their hand or think, pair, share or something, so that you're asking them to process it first,
Right.
say what they think, then you tell the answer and teach the topic. That's a wonderful active learning way to teach.
Thank you.
Thanks so much, everybody. We appreciate your attention. Bye-bye.
Thank you.
Bye bye. Thank you so much.
You're welcome.